Good afternoon, everyone. Thank you for joining us for our press conference today, summarizing where we are with Delaware's response to the COVID-19 pandemic in our state, our twice-a-week briefing. I'm joined with new participants today. We have Dr. Karyl Rattay, who's the Director of the Division of Public Health, who's been with us at most of our press conferences, and she and her team are doing a great job with the science and with the data that are driving the decisions that we're making on a day-to-day basis. Her personnel are on the ground in workplaces across our state, most recently, including this week, in our poultry processing plants in Sussex County, doing a great job there with the testing of poultry workers, with testing along with our hospital partners in Sussex County at Bay Health, BB, and Nanticoke Hospital, just doing a really great job there, and talk about that a little bit as well. We have Damian DeStefano over on the far side, and Damian and his team at the Division of Small Business and the Department of State have been doing an incredible job working with the business leaders across our state and business operators, business owners in 6 different sectors. I get a lot of questions, Damian, about are you going to have this group or that group representing business? We have a group, part of our team, frankly, representing 6 sectors that some of which have really taken it on the chin, if you will, our restaurant and hospitality sector, and we've been working with them. We have some additional interim steps that we're taking with restaurants. So we were on the call this morning with the mayors, and they were very positive to what's being proposed there, and we're excited about it. And then Secretary Jen Cohan, whose people are doing a great job in the Department of Transportation. She's going to talk a little bit about construction, and we haven't shut down. A lot of people forget about the fact that construction continued through this, and I think safely. I would go by myself a lot of the construction sites and talk to Secretary Cohan and to Brian Short at DCA, Paul Capodanno, Ed Capodanno at ABC about what I saw out there, and I'm very pleased ultimately that we were able to get a lot of construction done, keep people working, keep the economy going in that sector, and Jen's going to talk a little bit about that. You know, I've said in the last several press conferences that the decisions we're making now to reopen the economy in different sectors, working with Damian's team and working with business sectors, taking into consideration the responses that we got from the various, I think we had 12 Zoom town hall meetings across our state, several with small business owners geographically across our state, and several with the general public, and got a lot of feedback from that about things that we needed to do. I know Damian gets on a day-to-day basis feedback from folks that are on the ground in their businesses. Here's what we can do. And we're going to talk, Damian's going to talk a little bit about that with respect to restaurants. And the decisions that we're making now are more difficult than they were as we shut things down. You know, there was a lot of fear that was motivating that, and the fear in the unknown and the spread of the virus, and whether or not we'd have hospital capacity and enough ventilators to treat those critically ill. And we've gotten through that stage. When that was happening, most people were complaining that we weren't shutting things down quickly enough. And now I hear complaints kind of on both sides, whether that we're not opening quickly enough or that we're opening too quickly. As I've said several times, our objective is to strike the right balance, right? To protect public health, and to protect the strength of our economy at the same time. Turns out it's a challenging proposition. Everybody has a little bit different idea about how to do it. Our messaging has been clear. We're following the data, following the science, following the recommendations of public health officials and experts, and trying to balance that off with the practical needs of operating a business, getting revenue, getting people back to work, and that's a very difficult thing to do. But our messaging has been clear. You know, as we move back to a new normal, it's not going to be like the old normal. We're still going to have to wear masks. We're still going to have social distancing. We're still going to discourage large gatherings and keep people from apart. We just need to find a way to live and conduct business more safely, and recognizing that there's a virus still existing in our community. It can still make people sick, and people sick enough to die, particularly if you're elderly, which is why we're really leaning into our efforts to test all of our nursing home residents, to test all of our nursing home workers, and to protect that population. Our goal is not to reopen a day too soon, nor a day too late, and that's proving to be a difficult balance to strike. Many people have commented that we've had some challenges with our data of late, but consistently the data that I look at the most and that we look at as a team most intently is that hospital data, because it doesn't make any assumptions about people who haven't been tested. It doesn't make any assumptions about asymptomatic spread. People that are in the hospitals, we know who they are, we know what kind of condition they're in, we know if they have COVID-19 or that we presume that they have COVID-19. We know whether they need a ventilator or critical care or not. And right now, that hospitalization number has been going down, which is why we're moving and taking interim steps to reopen the economy. Some will say you're not moving fast enough. Interestingly enough, I get more complaints in the county, in Sussex County, where we have the most cases, positive cases, than in the other part of our state. And we've been incredibly aggressive. I think one of the notable parts of our response to COVID-19 has been the way that we've addressed and attacked the problem in Sussex County. At the community level, at the poultry plant worker level, and for the most vulnerable populations. We have tested in Sussex County at a rate twice the rate of Kent County and Newcastle County, justified obviously by the outbreak and the number of positive cases. We have as many positive cases, way more positive cases, as we'll see in a minute, in Sussex County than we do in Newcastle County. And yet at the same time, I hear folks from Sussex County saying we're not moving fast enough, and I understand that. But our message has always been clear that we're going to do it based on the science and based on the data and based on what's good for all of us. And it can't be every man for themselves. It has to be we're all in this together, and we're going to get through it together, and what you do and your actions affect your neighbors, and what your neighbors do affects you. I've been incredibly pleased with the response that I hear and I think that we've gotten from the public here in Delaware, from ordinary citizens following the restrictions. I talked to the mayors of the coastal towns who reported on conditions on the beaches over the weekend, and Mayor Coons in particular from Rehoboth Beach commented that very positively about people keeping separate. If there was one thing that maybe we needed to work on was people wearing masks on the boardwalk, which I know is simply, it's not a requirement, it's certainly a recommendation. And certainly not as important as if you're inside in a place like that. And so that was good to hear, because we're coming up on Memorial Day weekend. If you had asked me a month or two ago whether we would be opening beaches with less restrictions by Memorial Day weekend, I would have said probably not. And yet here we are, moving into Memorial Day weekend, ready to reopen the beaches with fewer restrictions. We're hoping to limit it to Delawareans by keeping in place our short-term rental ban and our 14-day quarantine for out-of-state travelers. And so that'll be a big test, but we appreciate our partners in Sussex County, particularly the hospitals. Beebe, Bay Health, and Nanticoke have done a great job with our testing sites there. We've tested over 10,000 Sussex Countyans as part of this effort. Great partnership in the community and in the work sites. And so with that, why don't we look at the cases? We're over 8,000 now. Sadly, over 300 total deaths. Most of those deaths, again, are in our senior compromised health compromised situations. We don't talk much about recoveries, but 3,700 recoveries. And here's again the number that I look at and continues to trend down, 236 hospitalizations. I talked to Penny Short this morning about hospitalizations over at Nanticoke, recognizing the situation that we have in Sussex County, and we continue to see kind of a flatlining. This is a decrease from yesterday. We're well under 300, which was about the peak. A little bit over 300 was the peak. It was an area where you started to think about, are you running into your capacity? Well, actually, our capacity is over 500 to statewide, closer to 600, depending on a day. So at 236, we feel very comfortable about that. Just going through the county by county, 2,800 cases in Newcastle County, and again, more testing done in communities, particularly communities of color. We've tested at a rate in communities of color in Newcastle County, a greater rate than in the general public. 1,200 cases there, positive cases in Kent County, and then the big number, 3,900 cases in Sussex County. And again, this is an area of the biggest concern about the spread, and also an area where I hear the most, the loudest about moving forward. And we're going to move forward based on data and based on the science, which is designed to make smart decisions to protect public health and to enable a thriving business economy at the same time. The breakdown by age, very consistent. Again, very few cases among our children and teenagers, mostly within the middle-aged population, and then that really vulnerable population, 65 and older, is where we really want to protect those folks and keep the virus away from them. And so our dashboard, we talked originally based on the recommendations of the CDC and the White House Task Force about using a steady decline in positive cases on a day-to-day basis. Obviously, as we were ramping up testing, that didn't make a lot of sense. It made more sense to look at hospitalizations and the percent positive on a day-to-day basis and new positive cases. And so that's what you see here on this chart. Current hospitalizations on the upper left-hand corner is on a downward trend. The orange little block underneath that is the Sussex County hospitalization rate, which is far below, if you just do the simple math, it's only 25% or thereabouts of the hospitalization rate in Newcastle County. So lots of positive cases down there, many which were asymptomatic, but a hospitalization rate that continues to decline. And again, the reason that gives us comfort, some level of comfort to start reopening. New hospital admissions, steady decline there. You can see in the middle chart in the top row, and then the measure I just mentioned, percent positives. And so while we're seeing a larger number, we see a number of new cases each day, as a percentage of the number of tests that are processed that day, it's declining. And we need to have that fixed, and I believe this is a 5-day moving average. It is, in order to smooth out the ups and downs. We have tested so many thousands of people over the last 2 weeks that it's been difficult to process that data on a regular basis. So we've alerted the public through these briefings. We've alerted to members of the General Assembly who've been following these graphs to that nuance in our data. But still we see what an indication of improving conditions on the ground. And there was a time when we first started testing in Sussex County, and we were using a little bit different testing protocol, but we were in the 25-30% and above percent positive. And now I think today we're 14% positive, somewhere between 10% and 15% on a day-to-day basis. So it gives us a good indication. And then the last two charts, just the cumulative number of positive cases, obviously, which is a bar chart that will continue to grow. Part of our dashboard requires that we have a certain amount of personal protective equipment to protect frontline healthcare workers and other essential employees, and the green light is on all of these: face shields, glasses, gloves, isolation masks, N95 masks, surgical masks. We still have a yellow light there on the fluid-resistant gowns and trying to stock up with there. And I heard Dr. Rattay say earlier that our warehouse is getting filled up with all this PPE, and that's about as good a thing as I've heard in a while, to be honest with you. So our goals overall are to balance health. You have to have both. In order to have a healthy economy, you have to have a healthy community. I tell about one of our leading restaurateurs on our call last week who said, I need to have conditions where my workers are going to feel safe to come back to work, cook the food, work the kitchen, clean the tables, and a condition where customers are going to come back and dine at my establishment. Georgia would arguably move too quickly to reopen their economy and restaurants. In their first week, only 88% of the previous population in the restaurants showed up to dine at their restaurants. That's not the kind of confidence that we want to see here in our state. We're all eager to get open, and we will do it in a way that enables us to have a healthy community, to have confidence in coming back to restaurants and to other public places, and where workers feel safe. So we're also adding to the retail rolling reopening, and an appointment only, many of those, and Damian can talk about that. That'll be effective tomorrow, May 20th. I like that date. And it'll be, again, another way of getting some revenue to those retailers, and Damian and his team have been working with them individually, as different kinds of retailing establishments, as well as collectively. And then again, the thing that we've heard so much positive response to is working with restaurants to expand outdoor seating, which is safer than indoor seating when in close proximity to folks, with the fresh air and the openness there, to enable them to work with their local towns and municipalities to provide for additional seating and tabling there, which also adhering the social distancing approach. So we've been taking interim steps for the last several weeks, and again, Damian and his team have just done an incredible job working with the retailers, working with the big business sectors, and folks who say, are we going to have the participation of business owners in our state? We do. We have on a regular basis, and we have for weeks. And so for those of you who are asking that question, the answer has been the same for several weeks, and you need to advise your constituents that is, in fact, is happening and will continue to happen. And so here are some of the things that we've done starting way back in early May and moving forward until the changes that we're going to make later this week. So with that, I'd like to turn it over to Dr. Rattay, and also once again thank her and her team for the incredible work they're doing, in particular for the very difficult work of all of that public testing there in Sussex County, both in the poultry processing plants. We will have tested thousands of poultry workers, their family members in communities, other community members that may have been exposed there in the small towns of Georgetown, Millsboro, Seaford, Milford, just doing a really good job there. Dr. Rattay?
Thank you so much, Governor. So if we rewind the clock a little bit and go back to March, one of our biggest fears was that we would be overwhelming our healthcare system. And as we watched what was happening in New York City, I think that enhanced, our fears. Delaware hospitals, Delaware healthcare providers, across the board, including our dental, our oral health providers in the state, all did a fantastic job across the board of stopping elective procedures at that time. Two main reasons for that were, not only did we need to make sure that we had adequate capacity for sick people in our hospitals and our ICUs, adequate ventilators when needed, but also we were struggling with a significant shortage of PPE, or personal protective equipment. As the governor just showed you, for our hospitalizations, we have seen a steady decrease for COVID positive patients. And although we're not exactly where we want to be, and that we don't have, as many gowns as we'd like to have in the state, we are doing so much better with PPE. In fact, across the board for hospitals and healthcare providers, that everyone's seen an opening of the supply lines for PPE. And so we're really happy to see those improvements. And because of all of that, it is a very appropriate time for hospitals and healthcare providers across the board to begin to resume elective medical procedures. Now, normally in non-pandemic time, most people are aware that we do a lot of promoting preventive care and well care, and certainly just annual checkups and visits, cancer screenings, etc. A lot of that has been put on hold, including management of chronic diseases, where people might go in on a monthly basis for management of their diabetes or their hypertension. And so we're really happy, in coordination with our Medical Society of Delaware and the hospitals and the Dental Society and others, are at a place where we are all in agreement that it's time to resume elective and non-urgent medical procedures in what would be considered by CMS, the federal agency, Tier 2. So these are procedures which, if you don't do them at this point, you could increase morbidity or mortality. That includes pediatric vaccinations, which the American Academy of Pediatrics just put out an article last week showing that vaccinations for kids have gone down in the last few months. Additionally, newborn and early childhood care is so very important. We've got to make sure that we get caught up on those visits, as well as visits to manage existing medical or mental or behavioral health conditions or new symptoms in established patients. So some of our partners have already begun to resume some of these Tier 2 procedures, but certainly it is appropriate to take this step at this point. And we've also additionally come to an agreement that these Tier 1 procedures, such as routine primary or specialty care, like preventive care, like getting an annual mammogram or colonoscopy or other wellness visits, that if our healthcare providers and facilities have enough PPE on stock for 2 weeks or more, that they are fine to go ahead with both Tier 1 and Tier 2 appointments at this time. But again, we really emphasize that it's important, certainly, that appropriate PPE be used by staff and as appropriate patients, but they also must have an adequate supply before they take these steps forward. Additionally, there's a number of other measures that need to be in place. So making sure that social distancing is appropriate, that staff and patients are screened for illness, and then environmental cleaning procedures in accordance with the Centers for Disease Control are all in place before moving forward. We also, in accordance with the health care system, really encourage continuing telehealth options wherever possible. I think if there's one maybe positive out of this whole situation, people are becoming more accustomed to using telehealth, and we really want to encourage continuing to do telehealth visits rather than being in person if that is appropriate for the course of action for the patient. One more thing I want to emphasize, and I will say our hospitals are telling us that they are getting a lot of patients who are showing up in the emergency department very sick, who are waiting too long for medical care. We know that people are afraid to go to the emergency department or to seek health care. Our healthcare providers, our emergency departments, our hospitals are very tuned into appropriate infection control. And we want to make sure that people don't wait to seek medical care, but get the medical care you think that you may need if you are suffering from any condition for which you may need help. And with that, I will turn it back to you,
Yes,
Governor.
thank you, Dr. Rattay. And I'd just like to underscore a couple of those points. That last one being very important is, the visits to the emergency rooms have been down, and that was a good thing for a period of time. But people need to make sure that they're seeking health care when they're very sick and they need it. And in particular, we've been scratching our head about why the hospitalization rate is not higher for the positive number of cases there in Sussex County. And again, hopefully folks are not sicker and staying at home. We don't have any indication of that quite yet from any anecdotal information or any death reports. But folks need to be seeking medical care if they need it. And then the other point is that, the hospitals have lost a lot of revenue as a result of not doing certain surgical procedures. And it's not something most states shut down or require their hospitals not to do elective surgeries. That's not something that I had to do as governor as part of the state of emergency declarations, but it is an area where hospitals need to gradually start going in as long as they have PPE, as long as we have capacity. Another reason that we've been looking at that capacity issue for the benefit of the bottom lines, if you will, of those hospitals, which are so important to each of our communities. Damian, thanks for joining us today. Thank you for your tremendous work and that of your team, working with those 6 business sectors, really getting the input from the people in the businesses themselves up and down their state and coming up with and working with public health. I know it's hard to balance the two, but you're doing a great job with it. Why don't you talk about some of the things that we've been working on?
Sure. Thank you, Governor. So the governor mentioned at the top of the briefing about the ways that we're continuing to engage with the business community, making sure they have an opportunity to offer feedback and submit their plans as we develop our Phase 1 guidance and the interim steps prior to entering Phase 1. We held 11 virtual town halls led by Lieutenant Governor Hall Long and with Kirk Foreman on as well, and members of the General Assembly to communicate with a broad swathe of small businesses and the public, get their feedback, answer their questions. We're also on a day-to-day basis, it's not a static process, on a day-to-day basis, our team at the Division of Small Business is communicating directly with the business community, both with industry groups, but also with individual business owners themselves in a multitude of sectors. We have formal teams across 6 specific sectors. These were the sectors where a lot of consumer-facing sectors where when we did move to the non-essential, essential business list, we curtailed a lot of their activities. And out of that process, we've begun to develop the interim steps you've seen and then the Phase 1 guidance. We used a 3-part framework for the Phase 1 guidance to try to provide as much clarity as possible to businesses as they do reopen what they need to do. The first was general guidance, and that's really guidance that every business and individuals have to follow as we enter Phase 1 in order to transact safely and be permitted to allow customers back in their stores. That applies to any business that's open in the state of Delaware right now, starting June 1st. Then next, we gave specific industry guidance. This is really where the work of those sector teams came in. We wanted to develop in specific areas like food and drinking establishments, like consumer-facing retail, like exercise facilities, guidance that pertain to their unique situations, and that was developed in concert with our public health officials. And so those 2 phases of the guidance were in the document released last week that provided the guidance for the first reopening phase. And then the third one is individual business guidance. We realized that given the multitude and diversity of businesses that we have in all the situations, that we wouldn't cover every single business activity in those 2 tiers. And so we wanted to make sure business owners had a place that they could go to get answers to those questions that existed once they had reviewed that guidance. And those folks are coming into our office and getting the information they need to understand how they can safely reopen. So This is really the general guidance for phase one. You'll see here a lot of it has to do with first what customers need to do, individuals while they're out. They still need to be making sure they're wearing cloth face coverings. Regularly washing their hands is important. We're asking both the members of the public, I think we have been asking this the entire time, but making sure as we move into this, we're making it clear, stay home if you feel sick. If you're an employee, particularly if you're an employee of a business that's now reopening and you may be going back to work for the first time, make sure you're looking at, there's a link on our website and on all the coronavirus websites across the state to public health's guidance that employees can go through to check themselves before they go to work. We encourage people to do that. And then just reiterating that it's important that we're continuing to physically distance from one another as we're outside, as we go back and some of these things reopen. It's still going to be critical that we do that to ensure that we continue to see our numbers heading in the right direction and that we can continue to take additional steps to reopen the economy. And that's really, as we get into phase one, what we want to look at. So then on the business side, there's general guidance on cleaning common areas, making sure that their break rooms are closed, frequency with which you have to be disinfecting and maintaining things like a bathroom, rules with staff, providing hand sanitizer to your customers as they come into your building, and just general things that all businesses should be doing, both at this time and as we move into a phase one reopening to make sure their businesses are safe as they have customers coming in. So with that, and on that topic, we've gotten a lot of questions we got during the town halls, and we've gotten questions since from businesses that were concerned, even as we reopen, and I think the governor talked a little bit about this, what can we do to inspire confidence in customers as they come back? And so what the Division of Small Business is doing in concert with public health officials is developing a checklist that businesses can fill out that certifies that they are taking steps to make their place of business safe for consumers and employees. It's a voluntary program, but what you get if you fill out the checklist and send it in to us is a window cling that can go on your business that certifies that you've applied that framework that we've put forward in the phase one reopening and that you can give customers a degree of confidence that the steps you are taking have been reviewed by the state and should promote a healthier workplace for your staff and your customers. And with that, I'll turn it over to Secretary Cohan.
Well, first of all, before Secretary Cohan goes, Damian, I want to congratulate and thank you again and your team. I know I've said it 2 or 3 times, but it really is. You guys have been awesome. Just for all those who keep asking the question, are you going to have a business task force? This thing moves so fast. You couldn't even have a business task force meeting timely enough to make the decisions that you make, and you're making it not by yourselves, you're making it with public health, balancing out those 2 objectives, protecting public health and the economic interests of small businesses and workers, and really doing a good job of it. But everybody needs to know that there are these participants and sectors that you're working with on a day-to-day basis. And again, working with public health, going back to our consistent messaging from the start, which is to be driven by the science and the facts to protect public health and the economy. So thanks for what you guys are doing. Secretary Cohan, lots of construction going out there.
Yes,
not
sir.
Not many cars on the street, but lots of construction.
Absolutely, and thank you for inviting me to be at this press event, and thank you for your leadership during this. And I have to tell you, and thanks to your foresight of knowing that the construction industry in Delaware would be responsible enough to stay working and do the right thing, has really paid dividends in keeping thousands of jobs. So thank you very much for your foresight in that. So talking about data, these traffic data numbers, we use this for 2 things. One, to basically make sure that everyone is abiding by the restrictions that are put in place by the governor. And 2, to be able to actually be more aggressive in some of our projects. So, as we head out into this new road to recovery, when some of you venture out for the first time, you're going to see your roadway and your transportation infrastructure in Delaware is going to look a lot different. And it's going to look a lot different because we've been able to, over the last few months, accelerate some projects. projects. Some of the most notable ones that you may be seeing when you're out and about is the SR1 paving from Smyrna to Odessa. We're almost complete with that. That was not supposed to be scheduled to be completed until later this fall, but thanks to our acceleration efforts, it's going to be done in the next couple of weeks. So we have these projects throughout the state. Right here in the city, the Christina River Bridge approaches also is going to be done by this summer ahead of schedule, and the same with the J Drive and SR 141. And then moving downstate, Main Street in Newark, we were able to take advantage of the lower traffic in and around the city of Newark, and with the fact of the University of Delaware students not being prevalent in that area. So that project is wrapping up right now, so that's going to be very helpful for the University of Delaware and the businesses along Main Street. So we're pretty excited about that. And you know, I really have to give a huge shout out to our Delaware contractors. They know what the rules are. They've been abiding by the rules. They know that the governor is riding around making sure that they're abiding by the rules. So a huge shout out to our Delaware contractors and all of the subcontractors. You know, you're talking full construction still happening on our roadways. That's tens of thousands of jobs and indirect jobs that are safe. We were much luckier than some of our surrounding states. We'll use Pennsylvania as an example. Early on, they shut down all of their construction and had to lay off a significant amount of state workers, 5,600 of them being in the Pennsylvania Department of Transportation. And they just recently started remobilizing, and if you look at the cost to demobilize and remobilize, that's very expensive for both the contractor and the state. So again, kudos to you, Governor, for understanding that construction could continue and continue safely. The other thing that's continuing is all of our engineering, all of our planning, working with our local firms, that's all continuing. So there's still a ton of development that's in the works that's going to be moving forward, all still happening while this has been going on. And I also can't say enough about the employees at the Department of Transportation. About half of them are telecommuting, but the other half, over 1,000 of them are still on the front lines. They're doing what the governor refers to as the people's work. They're out there managing traffic, they're doing maintenance, they're picking up litter, Governor, which I thought you'd be happy about, and a lot of it. There's still DMV frontline people are still waiting on customers. And then we really want to talk, just to spend a couple of minutes talking about our transit. On Sunday, we opened up our Wilmington Transit Center. We just did an event there earlier today. It is open for service. We have over 24 different routes. It's truly a multimodal facility. We're really proud of it, and it's a beautiful addition to the city. So we're really happy about that, and it really provides a convenient transfer station for those in and around the city. Almost every single bus route now transfers through Wilmington Transit Center, and it's a great public-private partnership. It was a $10 million project with EDIS, can't say enough about them. Also, Colonial Parking and Emory Hill Real Estate. It was just an all-around true partnership. And then as people are starting to go back to work and head out, I really want to reassure you that we are taking all the proper safety protocols on all of our transit. We know our bus drivers have been out there on the front lines of this, providing those essential trips to those hospital workers and essential employees. We've added additional cleaning for all of our buses each and every day. We are practicing social distancing on the bus by not allowing too many people on the bus, distancing the driver from the customers. So a lot of things that are happening, and again, I can't say enough about the employees at DTC and DelDOT as a whole, but we've been working very hard for you over the last few months, and like I said, as you venture out, we're here. We're heading into the Memorial Day weekend, so most of our construction work normally happens at night. You don't see that, but because of this taking advantage of the reduced traffic, we've been able to accelerate quite a bit. As traffic, and it is creeping back up as we loosen things up a little bit, we will be reverting back to night work on some of our majorly impactful projects, but got a lot of work done over the last 3 months, and you guys, as you head back out to the road to recovery, you're gonna see that firsthand. So.
Thank you very much, Secretary Cohan. You mentioned that your traffic counts are ticking up a little bit. Do you have can you characterize that in terms of a percentage? I know you mentioned something to me a week or so ago, but.
Yeah, so normally we had been seeing around 45 to 50% reduction in traffic during the week, and then upwards of almost 70, even 80% at one point on the weekends. But as we're seeing more things trickle in, people going back to work, and we're seeing that trickle up a little bit more during the week. And then again, we're thinking starting this weekend, we're going to see the increase on the weekends as well.
Yeah, and so that's very consistent with our approach, right, which is the gradual rolling reopening of the various different sectors. And it's an approach that was recommended to us by CDC and public health officials. It's a way of learning as you're going, educating as you go, bringing more people out in contact with one another, doing it safely. The report I got from the mayor of Rehoboth about last weekend was very encouraging and very positive. I did misspeak, though. I think I said that it was voluntary to have a mask on the boardwalk. It's voluntary to have a mask on the beach and required to have a mask on the boardwalk. So make sure that all the beachgoers get that straight. On the boardwalk, wear a mask. On the beach, wear a mask, or that's the recommendation, but not required. So we're really looking forward to it. At the end of the day, our ability to continue to do this rolling reopening really comes down to us and how we're going to react, how we're going to follow the limited restrictions and the lifting of the restrictions that's now going to occur over the next couple weeks with the interim steps, and then as we move into phase one on June 1st. And so we're all in this together. It's not every man or woman for him or herself. We're still trying to stay at home and wash your hands, wear your face covering. When you do have to go out for an essential business, practice social distancing no matter where you are, and think about your neighbor. Think about your neighbor, because your actions could be protecting your neighbor and neighbors who you don't even know about as we try to control the spread of the virus. Remember, the virus hasn't gone away. It's not going to go away. It really is, we're just changing the way we're managing it from a very strict stay-at-home order to closing down sectors of the economy, to managing it by increasing the testing, isolating, and contact tracing that we're going to do going forward as a way of isolating folks that are positive, COVID-19 positive, and protecting others in that fashion. And so we're going to need your cooperation with that new methodology. It will require some protections that we're not used to in terms of mask wearing and social distancing in public, and all the different changes that Damian and his people have been working out with small businesses across our state. And so that, again, clarifying, I think I said you're not required to wear a mask on the boardwalk. You are required to wear a mask on the boardwalk, and certainly hope that you do so. We have signage down at the beach communities to remind folks of their obligations and the restrictions, and we would ask you to follow them. So with that, I'd open it up to questions from the press, and I know we have some pre-submitted questions as well. Meredith, great to have you again with us. Thanks for coming.
I wanted to start off with universal testing at nursing homes. My first question is it required of all nursing homes to undergo universal testing? And how frequently is that being done? I know some bordering states are doing it 1 to 2 times a week.
Yeah, so I'll let Dr. Rattay answer. I don't think it's required yet. We may have to get to that stage in order to fully implement it, but it's not just, if you think about this whole approach to the virus, those who are most vulnerable, that's a key thing, is protecting nursing homes and senior citizens. You just have to just look at the data. It jumps right out at you. And it's obviously what's been recommended by the White House Task Force and CDC. So we really have to lean into it, and so do they, the operators of those nursing homes. And just like the operators of the poultry processing plants, very different, obviously, work, but it's about protecting their workers and most importantly, protecting those residents because they're so vulnerable.
Yeah, it's a great question, Meredith. So we are disappointed that having it be voluntary, the uptake has been much lower than we had expected. Approximately 15% of long-term care facilities have initiated the testing. Now, more have said that they are interested, but I'm a little bit surprised that it wasn't a significant uptake. We did hear feedback. There was some concern about staff being tested and being positive and then not being able to work. which long-term care facilities are struggling with staff shortages right now. But there are actually some protocols to help them work through that when there are shortages. So we are certainly feeling and hearing strong support to head into the direction of more mandatory testing, especially for staff. And that really is what we're also hearing from our federal partners as well, that it really is necessary that we keep a finger on the pulse in our surveillance work of what infection activity looks like in long-term care facility. So, and as Governor Carney was saying, this is our, among our most vulnerable population in our state.
And before the pandemic, a significant number of nursing homes were cited by CMS for having issues with infection prevention or control programs. I'm curious, obviously the state is focusing on testing and asymptomatic spread, but are you all doing anything regarding the spread of infection and the protocols that these nursing homes, especially ones that weren't doing so well before, going forward?
Yeah, absolutely. Really, since even before infection hit Delaware, we really began ramping up our efforts with long-term care. But I think we all realized heading into this that some of this was new. Hospitals, they have infection control down. Long-term care, it's more challenging in many ways, and so we've done a lot of work from the very beginning in trying to educate, ensure that they know how to use PPE appropriately, which takes some support, making sure that they have adequate PPE. We've required certain training for them, and we also have some partners. We have a federal team who's actually in long-term care providing technical assistance and support, especially for those who have cases or concerns. So we have been doing both a lot of remote learning support as well as hands-on in long-term care facility support, but it's a tough environment in which to control infection.
And I wanted to ask about just the reopening of small businesses. What oversight is the state going to have to make sure that these businesses are following the guidelines that you all have laid out? And also, what transparency will be done for the public for those who aren't following the capacity requirements or the sanitation requirements?
So before turning it over to Damian, just to kind of state some of the things that we've said every week, and we rely heavily on voluntary compliance, right? And the organizations, the Restaurant Association in particular, and kind of self-enforcement, they understand what's at stake. Now, having said that you still need, public health inspections, more inspections, and I think particularly initially, as folks, first it's just not kind of, understanding how to implement these things. We saw it with the big box stores early on. And we get Jamie Mack and his team, and they go out. We saw it with the poultry plants. And as they were educated, they got better. And as people showed up, it was one of my biggest complaints with Vice President Pence, when he called and said, do you need help with these plants? I said, yes, I need help enforcing these protections in the plants. The White House had just come out and said, you can't close any meatpacking plants which included our poultry processing plants. And so we had this conversation, and that's what we needed. They were able to use their USDA inspectors, whatever, to do that. So you need to have some of that. It's education first. They'll want to do it. They understand what's at stake. But it is a twofold thing, and that's why I like the insignia that you get, or the patch that whatever you're going to have on the door. Damian DeStefano certified, or State of Delaware certified. With respect to these measures, I think you're right on, and it goes back to Xavier Teshadou's comment about my employees need to feel safe, and my customers need to feel safe.
Yeah, the only thing I would add is a lot of times the best eyes and ears we have are citizens out there who are not shy about calling in and saying when they do see something that they feel like is not being complied with. We work closely with Department of Justice and with state police Our first goal is always to try to engage the business owner and make sure that if it's a misunderstanding, it's something they can correct. So that's usually where we start, and that's been successful up until this point at getting high levels of compliance.
I'm just curious if there was a scenario which it would turn into similar to restaurant inspections where that information would be public for those. Again, I realize it's different, but with the new normal that you all say we're entering, if there's a scenario where there's enforcement and an expectation and obviously public transparency if they don't follow.
I think we're hoping that the voluntary system we've created will message to consumers, and then we'll continue to work behind the scenes if folks do have issues at addressing them.
And one of the things that we are going to start looking at and turn our attention to, this has been a really challenging process. We've had all our energy and resources initially focused on the situation on the ground, the data, responding to it as we close things down. Now we've been both, dealing with putting houses on fire in Sussex County and allowing sectors to come up, getting public input, and really leaning into that. And there are folks that are looking down the road. We just put a group together in education to start looking at how are we going to bring children back to schools in the fall, and we've got to do that. And your question, I think your suggestion is well, it sounded like a suggestion to me.
I love writing about restaurant inspections, so.
It's a good one, which is what are you going to do long term, right? It's an observation, and I think those are the kinds of things that we will start have folks turning their attention to, not just with respect to this, but with respect to, healthcare delivery of services, some of these health disparities that have been exposed again, all of these kinds of issues that aren't going to go away, that require some sort of longer term way of addressing it, as opposed to the short term, put out the fire and putting out all the fires that light up. Other questions?
This is from the Delaware Public Media. Are you still seeing strong demand for testing? Do you worry that with the promise of phased reopening on the horizon, people could resist getting tested?
Yeah, so first of all, and I'll let Dr. Rattay respond from a public health perspective, I've been very pleased, number one, with our partnership with the hospitals. Could not have done this 40,000 plus tests over the last 10 weeks without the hospitals. They have shouldered the largest burden of that. Now, increasingly, that's going to be more of a public sector burden. They will be part of it. They will provide the foundation. We will, AJ Shaw, who's not with us today, he's our point person working with the two Dr. Ricks at Public Health and others, and standing up more community-based sites. But testing 80,000 a month, which is the goal, the recommendation we've received from outside experts, is going to be a challenge. And getting people to voluntarily do that will be a challenge as well. My guess is as we ramp up, it'll be a little bit easier. Then as interest wanes a little bit, it'll get a little bit harder. I think there's going to be an employer piece of this, and we're still trying to engage that with employers who want to test their employees. I've already heard from a number, including the president of the University of Delaware, as I mentioned last time. And so we'll need to incorporate that in the data information that we have and how we use that to evaluate the spread of the virus and its presence in our community. But I think it'll be a challenge to get folks to sign up to be tested. And I talked to one of the physicians today, Dr. Tam, who's the new CEO of BB, and he said, well, it can be just like another, get your flu shot, get your, the XYZ test, and it'll have to become a routine like that. Dr. Rattay, is there anything you want to add to that?
Yeah, I don't have a lot to add. I think initially over the upcoming couple of months, as we're really looking at the data and ensuring that we increase access points in places of the state where people haven't had as much access, I think we're going to see a lot of people interested in testing, and as we incorporate it more into routine care, or in more places like pharmacies throughout the state. I think, the easier we make it for people, I think the more likely it is certainly that they will be getting tested, but there certainly may come a point in time when people are less interested.
From Tim Furlong at NBC 10, if the 76ers can't get into Camden or Philadelphia to train, are you willing to let them work out in the facility in Delaware? Would it be possible for the Eagles or Phillies to use the field house if Philadelphia isn't a possibility? Additionally, what kind of timeline would you put on reopening sports, even if it's just University of Delaware football?
Well, I'm a big sports guy, and the idea that somehow as governor, because of something that I ordered, we wouldn't have a Blue Hen football season really makes me unhappy, although it is difficult to imagine how that might take place in a 20,000 seat stadium, a couple months from now. I'd love to do it. I understand NASCAR's coming back. Had conversations with them this week about what they're trying to do. Obviously, that's a little different. It's pretty much made for TV, I think, and doesn't require folks in the stands. Obviously, everybody who's a sports fan would like to see that come back. If we had the opportunity and were approached by an opportunity as described there, obviously it'd be something we'd want to take a look at, make sure it could be done safely. Again, follow the science there in terms of whether people are socially distant. Again, it would have to be done consistent with our 14-day out-of-state travel quarantine, and that's an issue that, frankly, I think has limited longer-term utility, but something obviously that's part of the emergency declaration right now.
From Jake Owens at Delaware Business Times, could you provide an update on the HELP program? Has it met your hopes in being able to provide aid? If not, do you envision any further changes to eligibility to extend more aid?
Just so happens that we have the HELP guy right here on the stage, Damian DeStefano.
I'm glad to provide an update. I just want to first say, Governor Carney mentioned the team at the Division of Small Business. The entire team there, we have about a 25-person staff, has been incredible throughout this process. But we have a smaller team that works specifically on the HELP program, who I think just deserves accommodation for what they've done in the last 8 weeks. We were seeing a few weeks ago a significant backlog. We got about 500 applications in the first 6 weeks of this program. We have 2 underwriters on our team when this process started, which is really was the bottleneck to processing. We've since expanded our team to 10 underwriters, and we've been getting through the applications much more rapidly as a result. As of today, I think we're close to about 50% processed, and that's as new applications are coming in, so we're up to about 600 applications now. And we've touched close to 2/3 of the applications, which means they're back with the businesses for follow-up for additional information. So we're happy to see the backlog being reduced. It's not completely gone. Once we do feel like we're processing at a speed that we want to be at with the current applicants, we will look at expanding it to new industries, because we know that the need is out there in sectors like consumer retail that have been hit pretty hard by this.
From Rob Tourneau at the Philadelphia Inquirer, if shopping malls are allowed to reopen on the target date of June 1st, will Delaware still enforce travel restrictions on out-of-state residents?
Well, I mentioned just a minute ago kind of what I thought about the out-of-state travel quarantine in the long term. Again, it's hard to tell where we will be on June 1st. We've used Delaware State Police to do mostly education and messaging, with some roadblocks on the border, particularly in the northern part of our state, where people from Pennsylvania, residents from Pennsylvania, will come in just over the line to go to liquor stores that were open here, while the state stores were closed in Pennsylvania, and the online mechanism that they had wasn't working very well. We will have Delaware State troopers on the road in Sussex County over this Memorial Day weekend with that same messaging, but again, long-term, you know, I don't, the utility of that long-term is, I think, limited. So we'll cross that bridge when we come to it with respect to shopping malls. Again, the objective of all that is to limit crowds and limit an onslaught of people all at once, and rather to put in place a gradual rolling reopening so we can do it in a safe way from a public health perspective. That's the objective, and that's the reason for that tool.
From Amy Cherry at WDEL, when will you reopen short-term rentals, and when you do, how will you ensure they're safe for use? Do you envision enhanced cleaning and staggered times between rentals?
Yeah, starting with the last part of that, just about everything we do requires enhanced cleaning and staggering between rentals and sanitation and all that, Damian, and you can comment briefly on it. The short-term rentals is one of those hot-button things as well, and right now for me it's really a tool. It's been a tool from the beginning with respect to folks coming from out of state to our beach communities, and we'd like to see Memorial Day represent a gradual reopening of the beaches and not have this wild onslaught of folks that are uncontrolled on the beaches and kind of violating all the restrictions and making it more difficult for us to safely transition into a new normal. And so that, again, is one of those tools that we'll continue to look at. Its utility, again, long-term, and staying power long-term, I think, is limited.
From Laura Ritter at Cape Gazette, will the parking lots at state beaches and places like Seashore State Park open May 22nd?
Yeah, my understanding is that they will be open for Memorial Day weekend. There'll be limited spaces. One of the objectives, again, is to keep crowds off the beaches, enable folks that do choose to come to the beaches, do so keeping appropriate 6-foot social distancing while they're on the beach, not congregate in big crowds. And so it's hard to enforce and hard to accomplish. One way to do it is to limit the number of parking spaces near the beach. That also creates unintended consequences of scarcity, which we worry about, where people flock to other areas that don't have similar restrictions. And so it really is, and this is a learning process for us, figuring out ways to control big crowds that are out of control, that threaten public health, while enabling people to go back to a new normal.
From Sean Green at WDEL, comparing mask use in Bethany and Ocean City on Sunday, about 90% were wearing them on the boardwalk in Bethany where it's mandatory, but about only 5% in Ocean City where it's simply recommended. Why is mask use important on the boardwalk where it's required, but only recommended on Delaware's beaches?
Yeah, so again, this was advice we got from public health, and I'll turn it over to Dr. Rattay, but it's essentially a function of proximity of one person to the next, congregating on a boardwalk versus on a beach, and it's the controllability of those two venues. And so that makes me feel good, and it confirms what I heard from Mayor Coons from Rehoboth, that people were following the rules. He did say they weren't kind of wearing masks like they should on the boardwalk, which is something that we have to work on. But the fact that they were wearing them in Bethany and not in Ocean City tells me that we're doing better than they are.
Yeah, I'll add, there's a team at Centers for Disease Control and Prevention that we're working with on our reopening guidance. And so we had a call with them specifically around reopening beach guidance. And we specifically asked this question, should you wear face coverings on the beach? Does it make a difference? If people can be social distanced on the beach because they are, out in the open air, it's fine. That means if a family is staying together, it's kind of like if you're on the trails or you're in a park. But it is very difficult to social distance on the boardwalk. You might be able to for a few minutes, but then there might be a few minutes when there's crowds. And so for that reason, we agree completely with what the Centers for Disease Control and Prevention advised, which is face covering not mandatory on the beach if you can social distance, but it needs to be mandatory on the boardwalk.
And let me just make a couple common sense comments. We're not making this stuff up. I'm not making this stuff up. This is advice we're getting from federal CDC. And with respect to mask wearing, we've been clear, we've been up and down a little bit on the advice, but we've been clear since we required it that it's more for protecting someone else than it is from protecting the mask wearer. And so if you think about it, it's really a question of, are you just thinking about yourself? Is this every man or woman for him or herself? Or is it we're all in this together, and I'm going to help by wearing a mask to protect maybe your grandmother from getting this because she's the most vulnerable in our community. So at some level, I think you got to cut to the chase with respect to the messaging and why these restrictions and requirements are put in place. It's not to annoy people. It's to protect others and the community so they can do what they want to do. Go back more unfettered in the community and at work and at play.
From Tom Lehman at WBOC, how worried are you about DFAC's projections this week? Have you heard any updated numbers regarding the budget?
My reaction is no good deed goes unpunished. It's going to be really bad. We've already projected to lose $750 million in revenue. All you need to do is look at Secretary Cohen's traffic counts, and you get an idea what's going to happen to the Transportation Trust Fund. I mean, the good news is we could still borrow money, and we can keep people working with capital projects, which will be something that we'll be looking at doing. We're going to lose a lot of the cash that we otherwise, in January had proposed for the bond bill and for the Department of Transportation, and that'll hurt employment. We are going to fight like mad to make sure that people don't get laid off. Can we achieve that? If ever there was a time to make sure that folks had income, now is the time. Well, that's going to be hard to do. But I think that should be probably the major objective, given the situation and given the dire circumstances that we'll be facing in terms of revenue, because we cannot borrow money in an unfettered way like the federal government. We can't print money as the federal government is doing with their stimulus packages. We have to balance the budget. We can only spend as much as the anticipated revenue, and we will work through that. The good news is we're in very strong fiscal condition coming into this, and so had a pretty good financial cushion, significant cash, which will run through quickly for sure, but it's not going to be pretty.
This is the last question from Delaware Public Media. Governor, what do you say to the 15 Republicans in the General Assembly calling for Phase 1 of reopening to begin this Friday, May 22nd?
Yeah, I'm very disappointed. Very disappointed in that letter because it just sounds political to me. This is not a time for politics. This is the time when Delawareans pull together, Democrats, Republicans, and independents. We're a state of neighbors. We treat one another like neighbors. We're going to get through this together as neighbors. And for a letter like that with the obvious political language and the divisive tone to it, and just the inaccuracies, it's just very disappointing and disturbing. And particularly with members that had signed it, I would note for the record that there are quite a number of members that did not sign it, which tells you something in and of itself. And some of the members, what's most disappointing are some of the members who did sign it, who I've talked to on a regular basis. They never led me to believe that, some of the things that are in the letter were how they were feeling. That's not to say we don't disagree. We can disagree and disagree strongly. We can disagree and not be disagreeable. But some of the tone and some of the parts of that letter, it's just over the line in my view. And I'll leave it at that, because this is not a time for politics. This is a time for the people of our state to pull together. This is a situation that we've never experienced in our history. It's uncharted territory for all of us. We've tried to make decisions using the data and the science to inform those decisions, incorporating points of view across the spectrum involving elected officials and leadership, Democrats and Republicans, both houses, mayors of every town across our state. And I want to thank the mayors for the call that we had this morning and some of the nice things that they said about what we are doing together. Appreciate very much that partnership. Their enforcement activities, particularly over this weekend, are going to be incredibly important. And lastly, I just want to thank the people of our state who have proven once again that if we stick together, if we take the kind of neighborly attitude that's always been a hallmark of the way we live our lives here in Delaware, then we're going to get through this. And I'm confident that we will. We'll be stronger on the other side. When I say the other side, it isn't to imply that we're going to just get to a new opening and everything will be like it was before. We're going to have to adjust to a new normal in order to operate until we have a vaccine or an effective treatment for this disease. But we'll get there. We'll get there faster, and we'll get there stronger if we walk the road together. And that's why it's important that we do that and still follow the guidance and restrictions, follow the rules. And if we do, you'll protect yourselves and your neighbors, and we'll be able to do more things that we want to do both at work and at play. So I want to thank everybody for joining us, particularly thank our new panelist today, Damian DeStefano. It's great that he's here and was able to accept my thanks and appreciation on behalf of frankly, the small business and large business community of our state. They need to know how much work that you have done and your team. You mentioned your team, Secretary Bullock and the rest, in enabling people to go back to work in a safe way, enabling businesses to operate again. Secretary Cohan for getting all that construction work done while the traffic counts were done and down. And lastly, thank you to Dr. Rattay and her team. And if I didn't mention it, I misspoke earlier by saying that masks were not required on the boardwalk. In fact, they are required on the boardwalk. So please wear your mask at the beaches on the boardwalk this weekend. Thank you very much.